Hello everyone, myself Rahul Ashok, pursuing my Bachelor of Physiotherapy degree from Marward University, Rajkot, Gujarat. So today in this video, we are going to study about the most important bacteria from microbiology is the Acinetobacter Baumannii, which is the silent superbug of the hospital. So as a physiotherapy student, you might wonder how microbiology will help in the physiotherapy. So it plays an important role in which it helps in understanding how it causes and what is the causative agent and how it transmit or spread and how to prevent from the microorganism, because the physiotherapist deals daily with the ICU patient in hospitals and the rehabilitation centers. So now let's start with the introduction. So what is Acinetobacter baumannii? So it's a gram-negative type of bacteria and it causes the hospital-acquired infections, and it's mostly found in the ICU setups, and it's a highly antibiotic resistant. That's why it's called a superbug. So the causative agent of this is the Acinetobacter baumannii, and it's a aerobic Coccobacillus bacterium. Aerobic means it's mostly rely on the oxygen for the growth, and Coccobacillus means it's a oval and rod-shaped bacteria, and it survives on in hospital for longer period of time, and it is resistant to many antibiotics. Now the mode of infection. So firstly, it will the hospital surface are infected, contaminated. So it will travel from it will spread from the healthcare professional like the doctors to the hands, and from one patient to another patient it will transfer, and which will enter in the other bodies, patient bodies, and it will infect the whole body, and it can also be present in the ventilators, catheter, wounds, and hence can cause the direct contact. The same, the spread, like it will spread from the ICU environment and the poor hand hygiene, contaminated surfaces like the catheters, bed, ventilators, etc., and the person-to-person contact, and which can lead to the severe complications. So how it damages the body? So firstly, the Acinetobacter baumannii will enter into the patient body, and it will rapidly multiplies and will release the toxins and form the biofilm, and which will damage the tissues, and which can lead to severe infection. So the major organs which are affected are the lungs, in which it causes the pneumonia, and in blood it will cause the sepsis, skin and wound, and it can cause the urinary infection, and in rare cases it will cause the meningitis. So who is most affected from this bacteria? So mostly the ICU patient, uh, then the elderly people, because they have less immunity and they are mostly weak, and the burn victims, then the immunocompromised patient because they have less immunity, and lastly the patients who are on ventilators, and there are the 49% of the cases in which the sepsis cases are the more. And here you can see ICU patients are at the higher risk. Like out of 10, they are the 5 people who have the sepsis cases. So the mortality rate means the death rate. So it is a severe infection which may have the 30 to 70% of the mortality rate, and it is the higher risk in ICU and septic patient, and because it is a drug resistant which will increase the death rate. So here you can see the mortality rate by the patient condition. The septic condition, it has a 60 to 70%, and decrease like 40 to 60% in ICU patient. Then other conditions, and here you can see the data from the death per country. So here you can see the India, which has the high risk, like the 20 to 50% of the death. Now, what are the symptoms of this bacteria? So condition wise, in pneumonia it will cause the fever, difficulty in the breathing and the chest pain, and in the blood infection it will cause the low blood pressure, shock, and the patient will get fatigue easily, and in the wound infection, the formation of pus, redness, and the swelling. So, what is the treatment of this bacteria? So, firstly is the antibiotic, which is the cholestyramine and the carbamazepine, and in sometimes the combination therapy is also used, like using the 2 or more antibiotics for the treatment, and mostly the ICU care, that is the intensive care unit care. Then the supportive treatments like the fluid and electrolytes to maintain the balance. And the most important, prevention is the better than cure. So firstly the hand hygiene, like washing the hands regularly, sterilization of the equipment or the instrument which are the present in the hospital setup, then the isolation precautions, then the proper antibiotic use, and the last, the cleaning the hospital surfaces. So at the end I would just like to conclude that it is a dangerous hospital superbug, and it spreads rapidly in the intensive care unit patients, and it is resistant to antibiotic. That's why it's called a superbug, and prevention is the best defense. Thank you for watching.